Four.
From the Glenn Beck Studio in New York, this is The Fourth Hour with Stu and Pat.
Welcome to The Fourth Hour. Pat Gray stepping into the studio as we speak to take on the day. We have a lot of stuff on tap for you. In fact, a couple of things we didn't get to on healthcare, which are vitally important to your future. And we must act now on reporting these stories because there's not another moment to waste, Pat. Not another moment. We can't wait one.
Really? Wow.
That's how important they are.
All right.
This is actually, I think, to me, the most fascinating thing of the day. And this comes from we try not to take partisan sources here as much as possible because, it's kind of tough. It's like you got this you never know. There's spin on it all the time. So we try to take it from fair sources. Unfortunately, this one does come from I would say, extreme right-wing source, the New England Journal of Medicine, which reports on a study, and as amazing as anything you've heard in the healthcare debate. Quote, if healthcare reform passes without the public option, this is no public option, 7.4% of physicians stated they would quit practicing medicine. 7.4%. That's unless they were nearing retirement, because in that case, they would... I think I kind of confused this here. Let me just restate it. 7.4% of physicians that are younger will just bail out of the business. But if they're nearing retirement, that number skyrockets to 21.8%. Who say they would retire early. The total loss of physician workforce, nearly 1/3 of physicians leaving medicine.
That seems like a problem.
Well, you think when you're adding 40 million people supposedly
you're
to the
40 million more patients and 30% less doctors? Is that like I don't know? That's like a doctor shortage, maybe?
Well, the thing about it is, if you read on, what many people may not realize is that health reform could impact physician supply in such a way that the quality of healthcare could suffer.
No.
Based on physicians' responses to the survey, healthcare reform could significantly intensify the effects of the physician shortage.
Huh.
So there's a shortage. This would intensify and make it worse.
What?
Goes on, over 50% of physicians, over half of physicians who responded, predict that a health reform package such as the one being considered, and that Dennis Kucinich embraced today, would cause the quality of medical care to deteriorate in America. When asked how health reform could affect the quality of medical care, 41% said it would decline or worsen somewhat. Another 14% said that the quality of medical care would, quote, decline or worsen dramatically.
But again, you're talking the right-wing kookery of the New England Journal of Medicine. You might as well be reading from a John Birch Society memo.
This is essentially... it might as well be Karl Rove just writing it for me. If a public option is implemented, because as we know, this is where it's going. It's why Dennis Kucinich signed on today. If a public option is implemented as part of health reform, 64.1% of physicians predict that the quality of medical care in general will decline.
That's only 64%.
Right. That means there's some.
There are some who
think the opposite.
There's some probably undecided, but so really 46% are either undecided or think it will not adversely affect.
But the thing about it is adversely affect, at least you're trying something. Because people hate this healthcare system.
We must do... The status quo is unacceptable and unsustainable. Unsustainable, unacceptable, unabashedly awful.
Well,
it's just we can't have the status quo. It's
Unthink.
Unthink what you've been thinking.
Unthink it, just like KFC. Unthink.
Unthink.
Which is a really, as an ADD moment, Glenn Beck, unthink, not a good slogan.
No.
But doesn't that mean Like,
hasn't really caught on either.
No, don't think about what's happening to your body as you eat this fried chicken patty.
Yeah.
Don't think about the fact that we're saying
I'm good at
it's
that,
healthy.
Though. I mean, I relate to it. I'm good at it.
Well,
clearly.
The problem here, Pat, as you know, hardcore right-wing sources are just lying in the media. For example, George Will. He said, quote, "When we started this healthcare debate a year ago, 85% of the American people had health insurance, and 95% of those 85% were happy with it." Liar, right? Thank God PolitiFact is here to point out the lies of that statement.
Okay.
First, we'll dispatch with Will's claim that 85% of Americans had health insurance. According to the U.S. Census Bureau, the leading arbiter of the number of uninsured Americans, Will is exactly on the mark.
He's exactly on the mark?
Mark.
Really? What?
He says that 84.6%. Oh, you have to round it.
Lied.
You have to round
he
it.
He did lie.
Unbelievable.
He said 85 and it was only 84.6.
Yeah.
What
Notice
a
he didn't,
scumbag.
Notice he didn't round down to 84.
I know.
Yeah.
I know, right?
I mean,
I know, right?
So,
and what about the other one?
Yeah, the other one's even worse.
Like,
Pat.
a lot of people are happy with it.
Right-wing lies. He said...
How much was his percent?
95% of the uninsured.
Oh, come on now. Okay, so...
Let's just roll through some of these polls.
Down.
Yeah, I will. You know what? PolitiFact did it for me.
Good.
The media's doing that work. A 2009 Quinnipiac poll. Only 88% said they were
pathetic liar.
Another Quinnipiac.
Oh, that is 6% off.
Yeah, how about this one? Another Quinnipiac. Only 85%.
7%.
ABC News. 81%. You really thought that was funny. Matthew Greenwald and Associates, only 88% satisfaction. ABC News, 81. Another Matthew Greenwald Associate, 95. 95% satisfied. Oh, wait, Matthew Greenwald, 91%. 86%. If you average all the 8 scores, the total rate of satisfaction is 87%. But one poll did actually hit
95.
Even I wouldn't believe you'd hit 95%, but they actually did in one poll.
It's amazing.